Good morning. My name is Debbie, and I'm presenting on behalf of Cancer Support Community on the cost of coping with the cost of cancer care. So, to ensure that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by community. That is Cancer Support Community. This presentation, I have extra notes, so if you need a copy of this presentation, you can check with Kelly or anybody at Cancer Support Community to get a copy of it. The overview is you want to make certain as you're going through your journey with cancer, which is known to be very costly, talk with your healthcare team about any issues that you have, not just your medical issues, but financial, anything to do with your employment, disability. They are all trained providers. They know how to deal with these things, and they can also refer you in the hospital to people such as financial counselors. So there are options that you have with health insurance. And there are options that you can, that are available for prescription medications. And there are some other potential sources of financial support and income. Cancer care is expensive. There are ways to get health insurance now with what was formerly known as the Affordable Care Act. Unfortunately, health insurance doesn't usually cover everything. In a survey done by Cancer Support Community, nearly 70% of respondents acknowledge some unexpected expenses during cancer treatment. It could be related to you have an adverse event while you're getting treatment. It could be that your doctor finds something else that they need to treat, things like that. And you can't always plan for these things. Your doctor your provider and your healthcare team try to do the best they can at ensuring that they can try to cover everything, but sometimes things unexpectedly come up. We all know that talking about money and not being able to pay bills is difficult, but this is a time when your health and well-being is most important and paramount. And so you really need to make certain that you can talk to your team about it. They often won't bring it up to you, so you need to be forthright and mention to them that you're having trouble. You can talk to the nurse if you don't feel comfortable talking to your doctor, but a lot of organizations now have navigators, and a navigator is typically a nurse or a social worker who works with your clinical care team to take care of issues that you have, like transportation, food, and also helping you with the cost of care. Health insurance. So we have group and we have individual policies. There are things such as HMO, point of service, preferred provider, an exclusive provider, and fee for service. And then also insured versus self-insured. I'm going to go back to that slide for a minute. So if you have your own policy, you're probably not working for a company. A group insurance policy would be somebody working, as I work for St. Elizabeth. I am covered by group insurance, and organizations would offer these types of HMOs and POSs and PPOs. If you are not working, you probably are going to be self-insured, and you're going to find a big organization like any of the insurance companies out there to secure insurance for yourself and your family. So when you have health insurance, whether it's through a group or on your own, always make certain that your health provider is getting a pre-authorization for your care. And I know this says if it's required, but always ask. You can ask your insurance company yourself, do I need a pre-authorization? But almost every organization with which I am familiar, all secure a pre-authorization for you. That means that if you get a treatment and it requires pre-authorization and somebody doesn't get that authorization, you might be subject to the cost of the care yourself. Nobody wants that. In this day and age, with all the things that are going on with treating cancer patients, most people aren't going to ever forget about that. They are going to make certain that they get all your authorizations done. Your provider will typically submit your bills to your insurance company for you, but you also want to make certain to review the bills for any potential mistakes. They aren't intentional. Sometimes things just happen. One of the things that you're going to get in the mail is called an explanation of benefits, also referred to as an EOB. And that is really important. That tells you your insurance company sends that to you, and sometimes they send it to you before the billing has happened. So don't flip out when you get this EOB. A lot of times people will come and say, hey, Deb, I got this EOB and it says my company didn't pay anything. my insurance company didn't pay anything. That's just because it's a preliminary explanation of benefits. It comes out sometimes before the billing even happens. So you just want to hold on to that. And then once the billing happens on the provider side, meaning the hospital or your provider actually sends the bill into your insurance company, you might get a revised explanation of benefits, also referred to as an EOB. If you need help, your insurance company will have a case manager available. That's just somebody that can help make certain you can navigate all of this insurance gobbledygook, because it is sometimes really hard to figure out. If you can't get a case manager, just make certain that you talk to the same person each time if that's possible. Write down their name, their phone number, and always keep accurate records. So if you are having trouble, normally if it's just a normal insurance bill, you won't have this kind of trouble. But if there's something that is out of the ordinary, maybe it has to do with a pre-authorization or some other kind of incident, you want to make certain that you keep records of it. And your provider probably is doing the same thing, but I always tell everybody, you do it yourself too. So the date and time that you talk to somebody, the names of the people you talk to, and what did you talk about? And then also keep with it any copies of your bills, your explanation of benefits, even how you made the payment. And if you can, always ask for approvals in writing. It's just an FYI for you to help manage this yourself. If you get a denial of coverage, and I have had to do this many times for patients, you can always appeal it. It isn't something that's readily available. In other words, they don't say, hey, if you want to appeal this, here's how you do it. You can usually find it on the insurance site, but you can just call and ask, say, hey, I think I need to appeal this because it got denied and I think it should be covered. Again, you want to do the same thing. You want to make certain that you have names of the people you talk to, their phone numbers, the time you talked to them, what you talked about. The big thing to note is when you get a denial of coverage, it always has a deadline on there. And so sometimes when you get a denial of coverage, it requires that the doctor has to talk to the doctor on the insurance company's end. And so what happens is you'll need somebody in the office to help manage that. So they have to set up the appointment between both of these doctors. And that is easier done by somebody in the doctor's office or the hospital than it would be for somebody like you and me. Always have a copy of your current insurance policy and benefit plan available. And again, keep careful notes. You want to, again, I'm reiterating, just make certain that somebody from the healthcare team can help you and assist you if you're having trouble. Don't feel like you're on your own with this, because there's lots of people involved that can help you. If you are employed, make certain that you talk to Human Resources, because they are the ones that normally manage insurance. Also, you can contact your insurance company yourself. Be prepared that, this is usually not an easy process, and you may be on the phone for a while, or it may take several phone calls for you to get through this, but you can get through it. It's always nice to have somebody working with you or helping you, or even a family member. So there are health insurance options available: COBRA, HIPAA, major risk plans. Unfortunately, in the state of Ohio, I think they eliminated major risk plans. It's still on this PowerPoint, but I don't think we do that anymore in Ohio. Marketplace plans, which was also the Affordable Care Act, Medicaid, and Medicare. And that website shown there, www.healthcare.gov, and that phone number are still valid. You want to make certain that you keep track of that if you ever need help with getting other options for insurance. Let's see. COBRA is a federal law that allows you to continue your insurance after you leave an employer. COBRA can be very costly. It's great coverage. It's the same coverage, but remember, when you worked for an employer, you paid a lot less money because there probably were either hundreds or maybe even thousands of people working in the company. So they were able to enjoy less cost to them, and they passed that on to you as an employee. So if you want more information on COBRA, you can go to www.dol.gov/EBSA. Again, that is a very good website, and that is still an accurate link right there. You're eligible for COBRA if you have employer-based health insurance and you left your job, you got laid off, your hours were reduced, You had coverage for a loved one who becomes eligible for Medicare or passes away, or you separate or get divorced, or you're aging out of a parent's policy. There are different qualifying events for eligibility for COBRA, and it can last from 18 to 36 months. Again, as I said, premiums can be expensive, but if you want to keep the exact same coverage that you had when you were employed, this is how you want to do that. And you get a 30-day grace period, I believe, 30 to 60-day grace period that you don't have to sign up right away, because if you do get another job and you were going to be covered by the next employer, you would have insurance depending on when that starts, whether or not you need to take advantage of COBRA. Oh, so the slide does say 60 days to elect COBRA coverage. They have to be paid in a timely manner. If your employer goes out of business or ceases that particular coverage, then COBRA will end. If you become eligible for Medicare, then you don't need COBRA anymore, and it will end. So if you work for the government or certain church-related organizations, or your employer has 20 or less employees, you might not be able to get COBRA. Again, you want to check with your HR department, human resource department, to see if they indeed offer COBRA. So when COBRA ends, what do I do? Well, you can go to a state health insurance marketplace plan. There are some things called conversions, which are available in some states. And then also there's the Health Insurance Portability and Accountability Act, also known as HIPAA, which is a guarantee issue plan. Let's see, I'm looking at my notes. Okay, so HIPAA plans. It's an option if you have exhausted your COBRA. So in other words, if you run out of COBRA, and remember it goes for 18 to 36 months, you might need something else. So there may be options in your state marketplace. You cannot have a gap in health insurance coverage longer than 63 days. So don't wait, make certain you look into it right away. Nobody wants to go without coverage, especially when you're going through cancer care. And also for HIPAA, you have to be ineligible for Medicare, Medicaid, or group insurance. Other health insurance options, major risk insurance plans or high risk insurance pools, as it says there, is being phased out of many states. So instead of in Ohio, we don't really have that anymore. Now we have just the marketplace plans. There's another thing called the pre-existing condition insurance plan. It's a federal health insurance option available in every state, created by healthcare reform. The insurance is for U.S. citizens or legal residents with pre-existing medical conditions who have been uninsured for 6 or more months. The problem is that that plan ended in March, and so what you want to look at is the marketplace plans. That's always the best thing for you. That link for PCP, PCIP.gov is still accurate, but again, it ended. So what you want to do is just look at marketplace plans. We're going to skip that slide. So Patient Protection and Affordable Health Care Act. I'm going to look at my notes here. All right. So known as healthcare reform, as you know, probably if you've been following the news, lots of information on the internet available about this. Lots of things changing. It's an everyday, something changes. When this first came out, there were no pre-existing condition exclusions or denials, and you couldn't be charged more because of a current or past medical condition. What you want to do is you want to make certain that you get enough information on this so you are fully informed as to what is expected and what you are going to be able to obtain from getting this marketplace, healthcare reform marketplace plan. Again, prohibits insurers from canceling your coverage, eliminates lifetime and annual limits, and free preventative care for most private plans in Medicare. So sometimes there are no deductibles, co-pays, or co-insurance, but again, what you have to do is you want to look at it, have somebody that you can work with. A lot of times you can work with a local agent or a broker who can give you more information about that. And again, if you would like to get more information about COBRA, when you go to that www.dol.gov, just Google on there or search for COBRA, and you can get more information. I meant to give you that earlier. That's also part of the US Department of Labor website. So one of the things you want to do in Ohio is go to healthcare.gov. So healthcare.gov, and you can enroll in an exchange plan. So Patient Protection and Affordable Care Act, new ways to get healthcare coverage. It expands Medicaid. Again, a lot of this information is changing every day. So you want to make certain that you're looking at this and asking for help. Again, you can just go on the websites that I've given you those links, do some searching. If you're not sure, talk to an insurance broker or agent, or have someone, maybe your provider, give you a little bit more information. State health insurance marketplaces, there's all kinds of things available for that. And they sometimes have limits on deductibles and out-of-pocket maximums. But because everything is changing so radically and so fast, you want to make certain you get this information from the websites themselves. So like I said, for Ohio, healthcare.gov, that will give you the most accurate and up-to-date information. And some states run their own marketplaces, but again, there's your link right there, www.healthcare.gov. We'll skip that one. So Medicaid. Medicaid is for people who are low-income individuals who meet eligibility criteria. And there was an expansion for Medicaid under the Affordable Care Act. It is funded by federal and state governments. So eligibility in one state doesn't guarantee that you're going to get eligibility in another state. For example, I live in Ohio, but I work in Kentucky. So if I needed Medicaid, I would get it in Ohio since that's where I live. Some individuals can have Medicaid and Medicare, but again, if you really want more information, you want to go to www.medicaid.gov. You're going to get the most accurate and up-to-date information when you go directly to that source. Medicare, that's a federal health care insurance for most US citizens age 65 or over. If you've been entitled to Social Security disability benefits for at least 24 months, if you are entitled to railroad retirement benefits, if you have end-stage renal disease, and then also a form of muscular dystrophy called amyotrophic lateral sclerosis, also known as ALS. Again, the best place to get this information will always be medicare.gov. So Medicare Part A, there's 4 parts, Part A, Part B, and Part C and D. Part A is free for most Medicare beneficiaries. It covers inpatient care. So you only need Part A if you're going to be sent to the hospital and have to stay overnight in the hospital for a couple of days. Medicare Part B is usually if you're going to go to see your doctor in the clinic. So that is referred to as outpatient care. You can decline it, but it does cover that. So you might not want to decline it. The premium is usually deducted from your Social Security check. And again, there's help there if you can't always afford the premium. It's an 80-20 coverage. So they'll pay 80% of it and you are responsible for the 20%. Again, you always want to make certain, what is the cost? Always ask, say, I'm going to come in and see you for my visit. Can you kind of give me an idea of what the coverage amount is so that you know that if it's $100, you'll pay $80, or the insurance will pay $80 and you're responsible for 20. There's also a thing called Medigap supplemental plans. Those are usually offered by external insurance companies such like Anthem, Humana, and they offer this to help you cover these out-of-pocket expenses that you might be faced with if you do have to go like inpatient. So these Medigap plans are also known as Medicare Advantage plans, and they also offer HMOs and PPOs. The plans are always different and they always vary by state. So again, Medicare.gov, if you go to that website, you can actually compare plans on Medicare. They have a wonderful website. I didn't put it on this slide, but if you go to that website and look it up, it's really nice. You can compare insurance plans. You can compare, what if I choose A, B, and C, or just A and B? How much will it cost me? So it takes a lot of the fear and guesswork out when you can just go somewhere like that and get all the information you need. Part D is on your prescription drug benefit. So this is what I was talking about. They show you the difference. Like on this one, they talk about, here's the coverage for catastrophic. This is your coverage gap. This is your initial coverage period. This is your deductible. So it tells you how much they cover for brand name drugs, how much you pay as the enrollee, how much the plan pays. So prescription coverage is through Medicare is different in each state, and you have to enroll in this. So you aren't automatically enrolled in Part C and D. You need to enroll in those yourself. Again, all of this is on the Medicare.gov website. It's very easy to follow. If you need help, you may be able to call Social Security office and have them walk you through it. One of the things that's really important is, how do I get my prescription medications? And I can tell you that I have had people come to me and say, I just got an order for a prescription medicine, Deb. It's going to cost me $500. Well, I know most people can't afford $500. A lot of times what will happen is your hospital will have a drug benefit available where they can get your prescription medicines at a reduced rate. So what you do is you call the hospital and ask if they offer that in their pharmacy. And if they do, they'll probably have you fill out a lot of paperwork. It's going to ask about your income and what your assets are. What they're trying to do is figure out how much is your need and how much benefit can they give you. But I know I did help a lady once who had a $500 prescription, and she was able to go through the pharmacy at the hospital, and her out-of-pocket expense was only $5. I was amazed. So there are benefits out there like that. You just want to make certain that you ask those questions. This isn't all about you all by yourself. There's lots of people there to help you. So again, most insurance policies include a prescription drug benefit. It's managed by the company that you work for, not by the insurance company. There's lots of rules about pharmacies and mail orders. There's usually a different number to call. So if you do have insurance through your company, make certain you have your insurance card. And also, if you're unsure about something, keep track of it by taking careful notes about anything that's different than normal. A formulary is just where they have certain drugs by the brand name that you're most familiar with, or they supply that same drug under a different name. So hospitals will have formulary. So let's say you take ABC drug. They still have ABC drug, but it's called C, D, and E and not ABC. It's the same drug, just a different name. So they can be prescribed without pre-authorization typically, but again, you want to make certain when they offer you this drug, is it going to be approved through your insurance plan, or do I need to find out if I need an authorization for it because it's not the same name? It is the same drug, just under a different name. If your provider prescribes a non-formulary medication, check to see if there is an equivalent. So if they don't have something in their pharmacy that is the drug that you need, they have to give you something that is not in their pharmacy. It may be more costly. So you need to find out, do they have something that's equivalent? So let's say you take ABC drug and maybe XYZ drug is similar, but not exactly the same. So that would be called a non-formulary medication, but it could be very equivalent. The only people that would know that would be your provider in the pharmacy. So you want to make certain that you find that out. Step therapy is just trying one drug. If that doesn't work, we'll try another drug. If that doesn't work, we try another drug, just like you're walking up steps or walking down steps. Also, you could get a denial if it's a non-formulary medication. We talked about that earlier. You want to make certain that you start the denial process of appealing it. And typically those are pretty successful. They just need to know that you're not prescribed this drug just because you wanted it. You're prescribed the drug because they didn't have your particular drug in stock, and this is an equivalent. So again, that's something your provider can help you with, and usually the hospital. Patient assistance programs. If you have no prescription coverage or you have limited prescription coverage, you can't afford to pay your copays, or you have Medicare Part D, remember that's the drug coverage for part of Medicare, and you've hit the donut hole, which means you've exhausted your benefits. There are programs out there to help you. The best one is this one called Needy Meds. And that link, www.needymeds.org, is still good. This is how their website looks. And what they'll do, this is a really great website. They go through all kinds of things. If you look over here, it has the patient assistance programs. They'll tell you how to do, they'll show you medication coupons. There's application assistance. They talk about the difference between brand name drugs and generic name drugs. There's disease-based assistance, free and low-cost clinics, discount drug cards. Sometimes when you go through the clinic to see your doctor or the hospital, you'll see they have a little stack of cards that say you can get a discount on your drug by calling this number. Those are reputable because those are provided by the actual drug companies, and they're trying to be helpful to give you a way to get your medicine if you can't afford it. So a really good website to keep track of. Employment and disability. So sometimes people can have cancer and they get treatment and they work through it. Some people can't. It's just chemotherapy is really tough on you and you just get sick, or you're having radiation therapy, or you're getting a combination of radiation and chemo, and it's exhausting and you just can't do your normal job. If you're a labor person where you're actually physically doing work, it's often hard on you and you can't. You have to take a few days off. So you have to work with your provider, or you should work with your provider to make certain that you're not too weak, and how much can you work. Sometimes you can get a certification from your healthcare team to say that, you know, I can't work more than 24 hours a week because my job is too demanding. And there's also disability insurance that's available. So again, if you like your work and you can do it and you feel like this will help me be distracted from what I'm going through with my cancer treatment, maybe going to work is a good thing for you, especially if you work in an office. It's a little difficult now because with COVID, a lot of people aren't working in the office and they're working remote. But if you have access to your coworkers, maybe via Zoom or Teams, you still feel like you're with people, and maybe that's good for you. I know I'm that kind of person. I like to be around other people, even if I need to do it through Zoom or through Teams. I feel like I'm still with people. Ask your healthcare team, what do they recommend? Explain what you do in your job. Explain what your personal life is like. Sometimes it helps for us to know, do you have a support system at home or someone close to you? And maybe if you can't work, you have people to be around, or maybe you just need to go to work because that will keep you occupied and you'll feel better. Also, the big takeaway is, what happens financially if I have to take time away? So there's a thing called the Family Medical Leave Act, FMLA. Some places offer it, most places offer it, some places do not, depending on how many workers they have. You can use it for just about anything. You can use it because you're actually taking off time to care for your spouse, your parent, or a child, or you're taking it off because you just are physically unable to go to work. There's certain criteria. I will tell you that's probably a document that has 10 pages to it. You fill some of it out and your healthcare provider has to sign it and fill some of it out too. It is unpaid leave of absence. So remember that you're not getting paid for this. It's just a benefit that you get to take off. They protect your job, so they're not going to give your job to somebody else. But you want to make sure you check with that too. But they do protect your health insurance benefits as well. So you have to work for an employer with 50 plus employees. I have known where other organizations have had less employees than that and they still offer FMLA, but you have to check with that employer. They usually ask that you have at least worked 12 months, even if you haven't worked consecutive months, or 1,250 hours. A good website to go to, we've talked about this website before, is www.dol.gov/WHD. DOL is Department of Labor. So that's a good link to go to. Again, you can find out a lot of information from these websites because they're up to date and current all the time. Americans with Disabilities Act. Most people have heard of the ADA. It's protections against discrimination in the workplace. So whether you have to have assistive devices such as a wheelchair, or you have assistive devices with your hands in order to work on a computer or do your work, you cannot be discriminated against. It is good for employees and job applicants. They make reasonable accommodations, and most states have fair employment laws. Again, here are two more links that you can go to: www.eeoc.gov or www.askjan.org. And these are good links. They're up to date and they have a lot of great information in them. We'll skip that slide. Social Security disability insurance. So it's a federal long-term disability insurance. You might be eligible if you've worked long enough and recently enough and have paid into Social Security. If you haven't paid into Social Security, you are not able to get Social Security disability insurance. You also have to meet a medical condition that meets Social Security's definition of disability. It's always good. I always advise people to go to this website as early as possible, whether you have a diagnosis now or later, and no matter what age you are. www.ssa.gov. That's the Social Security Administration. It'll show you what your benefits are if you're planning to retire, how much money would be left to your family if for some reason you did not survive, and also if you had to retire early, what your benefits would be. It's always up to date and they provide a lot of information. Applying for SSDI, so that's Social Security disability benefits. You can apply by phone, in person, or on the internet. And I have to tell you that their website is beautiful. It's really easy to follow. Again, it's not an easy process. There's a lot of documents involved, but you can go to the Social Security office and they can help you do it, or you can just start it on the internet. Just again, go to ssa.gov. Very easy to start the process. These are the things that you need when you start your application. Always have your Social Security number available, your birth certificate or other proof of age, all of the people that are treating you. So that's a lot, but you probably have information on any of your bills from your providers. And you'll also need dates of treatment and names of all the medications that you take. Again, this is all the things that you would typically do when you were trying to do something for yourself. You need all these things. And when you want to apply for the government, they do ask you for a lot of information, a lot of details. So if you're approved, your payments usually start within the 6th month of your disability. So if you apply in January, you're not likely to get something until June. And the amount of benefit is based on how much you've paid into the system over time. If approved, you may be eligible to extend COBRA coverage for an additional 11 months. After receiving checks for 2 years, you'll qualify for Medicare if you don't already qualify. If you're not approved for Social Security, it's possible to appeal. Again, it's a long, arduous process, but it is something that can totally be done. Know that what they're looking at is they want to make certain that, are you really disabled? Do you really need these benefits? Your doctor or provider has to approve this. So any information that he or she can provide on the document is very helpful. Reconsideration is not available in every state if you're trying to do an appeal. Sometimes it does require a judge, sometimes it requires an appeals counsel, or sometimes it even has to go through the federal court. If you are approved on an appeal, you may be eligible to receive retroactive benefits. That means benefits that go back. So let's say you applied in January, you were supposed to get the benefits in June, it didn't happen, so now it's December. So if you were approved and if they do grant you retroactive benefits, that means that if they started paying you in December, but you were eligible in June, you could possibly be paid those benefits from June through December. Other types of disability insurance, federal supplemental security income. Again, you can find that on the Social Security website. Sometimes people get private disability insurance. That's usually gotten through your employer, but I think you can buy that on your own if you'd like. It's probably costly, but at the same time, if you think about it, if insurance covers things that you haven't accounted for, it might be a good investment. And then there are sometimes state disability insurance programs available. Income and managing your medical debt. So there are resources in the community. There are nonprofits. There are local, state, and county organizations, community programs. And also a big thing is credit counseling. I will tell you that a lot of times patients have come to me and said, Deb, I'm thinking about selling my house, my car. I would say not to do that. Your treatment will end eventually. and you'll be able to go back to work or go back to your life. The best thing to do, I've found, is to work with the hospital or the clinic, wherever you're getting treatment, and work out a payment plan with them. Sometimes it's best to go ahead and get some counseling through an actual organization, because they can give you better, up-to-date, more current advice. But you want to think about not selling off your assets, because you'll need them. You need a place to live, you'll need a car to drive. But people sometimes get worried about, what am I going to do? Sometimes chemotherapy costs $50,000 for, a week's worth of chemotherapy. Most of us don't have that kind of money lying around, but you can always, the hospital bills you for that. They expect you to get to pay them at some point, but at the same time, they're willing to work with you. You just need to ask the question, how can you help me work through this payment process? So working with a financial advisor, make certain that you're working with someone who's credible. If you haven't, you can go through places like Cancer Support Community and find out, do they know anybody that's a financial advisor? The hospital usually can give you a financial advisor to work with in the hospital. They may not be able to advise you on all aspects of what you're going through, but they can probably help you with everything with your medical coverage, life insurance, and disability benefits. And then also, if you're going to work with an advisor, are there fees, or is this a free service? Retirement funds. If you are not eligible, so at 59 and a half, you're eligible to start taking funds out of your retirement if you have been working. Again, you have to pay taxes on that. So you have to pay 20% to the federal government and sometimes 10% to the state. But if you're not at that age of 59 and a half or older, you might be able to borrow from your retirement fund, but you just have to check with your HR department, with your employer. Sometimes medical bills can qualify as a hardship. And again, you may have to, this is talking about taking funds out of your retirement. You probably are going to have some kind of penalty, and you're probably still going to have to pay income tax. Again, talk to somebody about this, because, is it better for me to keep my retirement fund and figure out another way to get the money, or is it at the point where I have to take some money out of my retirement? There are resources available. Again, we've talked through this PowerPoint that it's an empowerment approach. So sometimes it is just about you reaching out and asking all those questions. I think people feel more empowered today than they've ever felt, because especially during this pandemic, we've all had to go through a lot of things that we didn't have to go through before, and people have to start asking for help when they weren't accustomed to doing that before. It doesn't mean that you're weak or you're not still very independent. The thing is that we always want to ask our friends and family, I am in need right now. Is there something that you can help me with? And sometimes they know somebody that can help you. And are there any questions? We've pretty much finished everything. I just want to make sure that you know that there's help out there. Sometimes places like Cancer Support Community can just give you directions to go in, and you can ask a lot of questions. If you don't understand something, start with your provider. Your doctor and the people that work in that department are usually the people that can help you. I also know that the American Cancer Society offers a lot of information. So if you haven't gone there, go there and look. They have all kinds of referral links. One of the things they have is the National Hunger Hotline. I know it's hard to believe, but sometimes people going through chemo are so worried about their bills that they forget that they have to have money for food. And so there's food available. There's also temporary assistance for needy families. So that's also on the government's website at www.hhs.gov. And then also there's a Universal Service Administrative Company that is a resource for if you have low income. Also cancer.net, cancer.net, offered through ASCO, has a list of financial resources that are available. So there are resources out there. It's a lot of work. A lot of times it's better to ask your family if they can help you, because your job is to stay healthy through all this chemotherapy and radiation therapy, and just keep a positive attitude. And this can be overwhelming. So ask for help. We're there to help you. Thank you for participating.